Make it okay. Yeah. So good evening, everyone. Good evening, Neeraj sir. Good evening, guys.
Good evening,
So we
everyone.
have seen lot of people are there from medicos and non-medico profession. So like that, Sunil Kurade sir is from Pune. He is a massage therapist. Vaibhav Jadhav sir from Satara. He is a non-medico. Then Dubey sir from Mumbai. Sanjay Bansode sir from Pune. Nidhi ma'am, physiotherapist from Ahmedabad. Then Sominath sir is from Chhatrapati Sambhajinagar. He is BHMS doctor. Anit Rao sir is a government servant, government officer, and he is doing a naturopathy too. And by adjusting his job, he is serving the people. And Suprita ma'am is physiotherapist sir. She is from Karwar, Karnataka. Vishal Dubey sir is from Mumbai, and he is working as a sports therapist. Okay. Then Pradeep Patil sir is from Gujarat. He is a massage therapist. So this kind of mix mob today we have. So
Yes,
यहाँ
sir.
पे हाँ yes. So Hindi is comfortable to everyone. Yes. So anyone else
Yes, sir.
that not
Yes, yes,
comfortable
yes.
with Hindi, especially ma'am from Karnataka. So
I have some problem in Hindi.
okay. Where you are from, sir?
Aizawl.
Your sound is your voice is breaking. So can you put in a chat,
It's
sir?
India.
Okay. You are from out of India. So put your destination in a chat, sir. Okay. And we'll conduct in a English and Hindi both. We'll try to convey, and anything you feel that you are not able to understand, put those questions in a chat. And after session also, we will I'll connect with you and we'll get a talk one to one. Okay. So yes, Neeraj sir.
Yes,
Uh,
sir.
yeah, we will start. And hello guys, we have a Neeraj Shah sir here. So he is our core trainer for the chiropractic, osteopathy, visceral manipulation, and all these protocol. And sir has uh, several of international certifications and experience. He is a BNO as Doctor 2 and have a specialty in visceral manipulation and podiatric and lot of cleansing therapy he is doing. So he'll introduce himself too, and he'll let us know that what kind of session we are going to conduct and what's the need exactly to become a healer in a manual medicine. What is medicine? So first of all, sir, we will start with the question: what is manual medicine? And give
Sir,
a short introduction first.
I am a healer Neeraj Shah. I am a certified visceral manipulation practitioner, IASTM practitioner. I am a podiatrist, food biomechanics specialist. So, what is manual medicine? So, in short, I would say that using a logic in treating a patient from root cause is manual medicine. That means if I would have been to elaborate this, what does it mean? That if patient is coming with a knee pain, and if you are treating direct the knee pain and you are not going to the root cause that why the knee pain is happening, then you are doing illogical things. So manual medicine, osteopathy is body is one unit where we treat body as in one unit. So we need to do whole assessment, everything, visceral, musculoskeletal, structural, psychological, everything. And when we do this, that is what we treat the root cause. And manual medicine, everything we do with our hands are the best tool. We use very least number of tools to treat the patient. In visceral manipulation, with the help of our gentle hand, we mobilize the organs, as every organ has its designated movement, mobility, and motility. So, with in manual medicine, we mobilize the every organ. Same, we mobilize every joint. We mobilize every uh, fascia, everything. So it's always treat the symptom, and in these 3 days, that is what we are going to teach all the healers, those who are going to attend, is we are going to teach them to use the logic in treating a patient. Doing illogical things, if a patient is coming, we are manipulating his cervical, we are manipulating his lumbar, we are manipulating his shoulder, his wrist, his elbow. Is it necessary? No, not necessary. So, by using logic, root cause, in-depth analysis, we will be treating patient. And then we'll, that is how we get 100% result to patients. Yes, sir.
Yes, thank you, sir. So, let's talk about the workshop. And you have any questions, you can put in a chat. I want an interactive session today. So, uh, here are some chats, sir. Arti Kumari sir is from Bihar,
Yeah.
and Nitin Sonawani sir is a general practitioner.
Yes.
And so I'll start with the presentation now. We'll conclude it, and then we'll again go for the question and answers. Okay.
Yes.
Technical issues there.
Satya, that I would like to ask one question to all the healers.
Yes.
Yeah. Everyone put in a chat box according to them which is the most important part of our body. हर किसी ने चैट बॉक्स में डालना है उनके हिसाब से हमारे बॉडी का जो है सबसे इंपॉर्टेंट पार्ट कौन सा है. Everyone can put it in the chat box.
Brain, heart. Yes. Everyone have to reply. I am not going to call your names.
Heart.
Can you see the chat, sir? Yes, sir. I think not. Yes. Check, sir. Now, can you see the chats? Sir, unmute yourself.
No, I can't see the chat.
Okay. So, so participants will not allowed to unmute themselves.
Yeah.
Okay. You just have to put your queries in a chat. So, sir, a lot of replies we are getting. Someone
Yes.
is saying brain. Most of the people are saying brain, heart, then legs. Our students, some of our students have given the correct answer. So I will not
Yeah.
resolve it. And brain, heart, kidney, lung. Okay. So
Yes.
let us proceed.
Yes, sir. You start with the presentation, then later on in question answers, we'll educate everyone.
Okay. So we have that presentation also. Shall we start with that presentation? Or
Yeah.
later on, we'll start.
Later on, later on. First, we'll
Okay.
talk about this. Our
Okay, so here you can see that divine touch. So how divine touch? You might have seen the videos on my YouTube or the one video I have shared in a group also. So what is divine touch and how that divine touch we are trying to deliver in your hands? Okay. So divine touch, basically our concept is the human garage. Okay. So get healed and let's heal others. Arti ma'am, why you are annotating? Do not do anything on a screen. And so we are here going to conduct a workshop like treatment and training workshop. So everything you are going to experience on yourself too in this workshop. And during this workshop, it will be a totally hands-on workshop. And for this workshop, we are try to accommodate all of you in a single resort and your trainers too in the same premises, so that everyone can take much more from them and they can deliver you a lot apart from the uh, other things. Because when we are trying to conducting on our centers, the patient keep on coming and a lot of time get used in the other work. So here uh, we are trying to deliver some more rather than our other camps too. So we'll explore that. Then the concept is the human garage. So what is human garage and why human garage? Okay, so because it is not like to treat the patient only every time. Okay, so we have avoided several thousands of surgeries till so far. So we have helped to avoid, not I can say the avoided exactly. So the human garage is concept to making people conscious about the things. Okay, so either you do not have any kind of pain symptoms, still you have to park yourself in a garage for the regular servicing, alignment, and cleansing of your body. So, on this concept, we are promoting the divine touch, and the effect of it results that Gold Gym has tied up with us with this concept, and we are the first organization which have been tied up with any multinational brand of gym. And people used to get connect to us, the health conscious people, and we are conducting a health camp for them, residential camp too. So apart from the patients or any person is in a pain, the fitness conscious or elite class to get attracted to this concept, and we are try to delivering this to the every individual. So the benefit of it, it is what the every person on earth is become my customers. Okay, so on that basis we have to promote our business, and the people those who are in a pain will automatically come to you. There is no issue. So let us uh, look towards the core ideology of divine touch on which we are working. So in the very first time I'm going to share this with you, because you must know on which ideology we are working, and if you wish to join to promote the same ideology, so you can be the part of our mission. So our mission is mission Har Ghar Healer and Har Ghar Healing. So our core purpose is to imbibe the culture of Vasudhaiva Kutumbakam on every individual heart by achieving the life transformation of mankind in all aspects of mind, body, and soul through the holistic healing based on Hindu mythological. Mythological is means people used to connect with the word mythological, but it's our factual science. Correct? So traditional healing is nothing but the science. Hinduism nothing but the science, and that science we have to implement, learn, and deliver. Then only people will understand the magic of our scientific mythology. Okay, then core value, divinity. How people are able to unmute. Okay, then core values. Our core values you can see here. Are you able to see my screen properly? Reply in a chat. So core value D, divine. D for divinity, E for integrity, V for visionary, E for ingenious, and N for the nation first. And at the last, what we have to cause is the enlightenment of every individual. So our goal is there. It is called as a big, hairy, audacious goal. The hairy and audacious, like a big gorilla, we can say. So to become a world's biggest organization of 5,000 plus healers. For that, I need your cooperation to offer a pain-free and totally healed life to 2 crore plus mankind's by the year 2035. So with that mission, me and my team and my healers, I got through my these uh, workshops and training programs since last 3.5 years. So we are delivering this to the society, and till now we have me and my team. So individually, Divine Touch has served more than 9,000 plus people, and with the count of my experts, healers, which have been developed from the healers factory, so count maybe might be more than 25,000 people. So that data also we are gathering now to present to the some authorities. So now we'll see what the demand for the holistic healing. Okay, so what is the demand? What's the career? Because today's our agenda is career in manual medicine, especially in India. So in foreign it is good practice and people are quite aware about this. So they used to go to the chiropractor before the allopathy. But in India, the lot of awareness is required and it's coming now. So demand for the holistic healing, if you see after the corona, the demand has been increased a lot, and we can see till 2033 what will be the size of US dollar billion. So it will be a around 1500 billion industry. Okay, and lot of the biggest population the India is holding among all the worlds. So we are having a great opportunity over here, and with the concept of human garage, we can make it more vast, okay, in a society. So there is a lot of scope for it. Then what we are going to learn and what approach are must be there. So approach must be to heal the root cause or to analyze the root cause. So here we can see the diseases are like obesity, heart disease, arthritis, diabetes, autoimmune disease, cancer. But what is the root cause? Because generally practitioners are trying to work on a symptoms, and rather than if you try to work on a root cause, patient's demand is to work on a symptoms. Because if I have a pain on my in my knee, then I am considering that doctor must uh, touch to my knee or give a therapy on my knee only, but root cause may be at your back or calf or plantar fascia anywhere. So we have to treat the root cause. It may be, it may not be some kind of musculoskeletal pain. It may be due to the visceral uh, issue. So we have to identify those causes. So root cause is different, which is not seen easily. Okay, so we have to diagnose those. So on that basis, we are going to conduct all 3-day workshop. Okay, so root cause may be emotions, reset, then inflammatory imbalances, detoxification imbalances, and importantly, structural imbalances when it comes to the chiropractic, digestive imbalance when it comes to the visceral osteopathy, immune imbalance. So everything the way we have to identify. So we are going to conduct a 3 days hands-on workshop. So workshop is nothing but the hands-on practice we are going to do for all 3 days, and the all three systems you are going to learn how they are connected, interconnected to each other, how any pain have the connection with all muscles, skeletal system and visceral system, and how we can diagnose that pain. So on the day 1 and day 2, we are going to work on a osteopathic articulation, bone setting, body alignment, spinal alignment, and the focus is on the mobilization, apart from giving the high velocity thrust, and the cell correction or indirect technique we are going to use here. So another day it is IASTM and myofascial decompression. So just the releasing muscle through the massage is not the complete solution. So releasing the fascia and toning muscle back to their position, which is the important thing to get healed or to uh, make body align properly and to retain it aligned after the treatment. Then it comes to the visceral. When your body structural imbalance get caused in a body, then all your visceral organs have been put on your skeletal itself. So their position also get disturbed and they are not able to function properly because they don't have a sufficient space to breathe. So we can say that their mobility and motility get restricted because of the structural imbalances. So that we will see, as sir said, that we will see in a later slides. So on that issues also will focus. So now we have in here video. A lot of people have seen the videos in on YouTube, and they might have keep on asking me, sir, that मला अशी मान मोडता येईल का? Am I able to manipulate the neck? And am I able to generate the sound, such kind of big sound from the body? So for that reason, they used to inquire us. But making a sound is not the healing, and sound will be generated. But for that, you have to give a big thrust. It is not necessary. So what it will cause? And in case of cervical, it is the most critical part of the spine, and to playing with it requires a lot of knowledge, experience. So no need to uh, give a thrust to the cervical to align it. With the use of mobilization of your feet, you can align your cervical. So such kind of indirect techniques we have for every critical adjustment that you will only get at the divine touch, and it comes from our immense practice, research, and the expertise we are keep on learning from the experts. So our experts to keep on learning and deliver it to you, and within very low cost we try to deliver each and everything to our existing student and upcoming. So first or 3 years before, we used to conduct a bone setting camp only. Then we have made a myofascial release and muscle toning compulsory for that. And once we come to know that the how visceral, how 40% plus problems are actually related to the visceral, and we learn the visceral manipulation. Now we have made that visceral manipulation compulsory too in our workshop. So whether if someone is asking, sir, I just want to learn bone setting, so you are not allowed, huh? Yes, you are our previous students, and you now you want to upgrade yourself for myofascial release or visceral manipulation, you can attend that session only. But you are a fresher, or either you are a chiropractor, then also all 3 days is compulsory for you. Okay.
When you crack your neck, it forces your joints to move, which can sometimes cause small air bubbles in the fluid to burst, creating that popping sound. But if you twist your neck too forcefully, you might tear the lining of a blood vessel. In rare cases, this tear can lead to a blood clot forming, which might then travel to your brain. Once there, the clot might block blood flow and could cause a stroke.
Yes. So as you have seen what it can cause. Okay. So just trying to make a sound will be dangerous for your practice and for your customer too. Okay. So we are going to learn all the aspect of healing. So what we are going to cover and what we have, if you want to learn any of it specially, so you can go for those sessions also. We have recorded sessions too. So bone setting, body alignment, osteopathic articulation, myofascial muscle release, IASTM, instrument assisted soft tissue mobilization, especially in case of gym or athletes, you need to do this therapy, and they are in the search for this therapy. They used to travel to the cities like Mumbai or Bangalore for these therapies, or up, even though to the out of India also they used to travel for it. So these things you can uh, implement in your practice. Then functional cupping we are going to cover. So cupping is too vast, but here you can see either you are doing a cupping too, but the what cupping kind of cupping or decompression of the muscle you are going to see here, it will be a unique definitely. And then visceral manipulation, sports therapy and taping. Someone is there, a sports therapist. I think so. Dubey sir, you are a sports therapist, correct? So we have a sports therapy and taping too. So this kind of protocols we have. So we can go into deeper also in that modalities. So now we'll understand how any pain have the connection with all three systems: muscle, skeletal and visceral, and how it starts. Okay, so we are going to learn on these two and understand these two. And there are similar pain symptoms like sciatica or frozen shoulder, but which are actually started from the visceral, but symptomatic treatment will keep on treating on the body part. Okay, so we have to diagnose those also. Those things have some symptoms, some diagnostic methods, that also we are going to cover in our session, and with live example. Okay, so here is, let us know the concept and misconceptions. Okay, so how our body has connection with each other. So we'll see this video, good video.
The causes of slouching that no one will ever tell you about. So you're already bent like a ram's horn, like a question mark made of flesh, so to speak. There are areas of the body that are tense, that hurt. There's curvature. You want to stretch, loosen, and relax all of that. I understand. But unfortunately, it doesn't work like that. Just because it hurts somewhere doesn't mean that's where the problem is. Things are often far from obvious. So, we need to remove the muscles. And here we see the intestines. The way the body is actually structured, everything influences everything else. So, if there have been any abdominal surgeries in the lower part of the intestines, like an appendectomy, a C-section, or anything else, it directly affects the mesentery and the entire intestine. And the intestines affect all the internal organs, and even pull up the thoracic region. And so, the desire to curl up, to slouch, isn't because you weren't taught how to walk properly, but because there's tension inside, and you need to work with that scar tissue, both physically and psychosomatically, and then the slouching will go away.
Yes. So Neeraj sir, can you elaborate on this video?
Sir. So as before I told
Sir,
you
your
that
sound is not coming. Just a minute. Yes, yes.
as before told you that we need to use logic and osteopathy. Chiropractic is not a separate entity. Chiropractic is a branch of osteopathy. Osteopathy is manual medicine. So in this video you saw it was related to the posture, slouching posture. So what it says is that because of there was a rigidity in fascia, and everything is connected. Your nervous system is connected to your visceral system, is connected to your musculoskeletal system. Everyone is interconnected. So can you just play the video, sir, so I can?
Yes. Sound you want, sir?
Yeah. So I can just
Speak. There are areas of the body that are tense, that hurt. There's curvature. You want to stretch, loosen, and relax all of that. I understand. But unfortunately, it doesn't work like that. Just because it hurts somewhere doesn't mean that's where the problem is. Things are often far from obvious. So, we need to remove the muscles. And here we see the intestines. The way the body is actually structured, everything influences everything else. So, if there have been any abdominal surgeries in the lower part of the intestines, like an appendectomy, a C-section, or anything else, it directly affects the mesentery and the entire intestine. And the intestines affect all the internal organs, and even pull up the thoracic region. And so, the desire to curl up, to slouch.
Yes, sir. Explain this part, then we'll play again.
So the one thing, if you had heard him saying that it's not always where the pain side, the problem lies there. That means if, as told, if you are having pain in your shoulder, no point in treating over here, because actual root cause, it's always like this, that the pain side and the root cause, they are always apart from each other. Means if you are having pain over here, that means the root cause is far from this side. It may be in your liver, it may be in your legs, it may be in your back, something elsewhere. What we are doing, generally what we do is, if patient is coming with neck pain, we treat the neck. Patient is coming with a shoulder pain, we treat the shoulder. Patient is coming with a knee osteoarthritis, we treat knee osteoarthritis. But the actual root cause is far away from that pain side. So root cause is always far away from the pain side. So that is what, in this video it's elaborated. Even if you have a surgery at the age of 4 or 5, that can hamper your mobility, your functioning at the age of 30, at the age of 50, because the fascia, which is the most underlooked and untouched part. Now what is fascia? It's an connective tissue, but it has far more than important than just and being a connective tissue. It's fascia which is holding all our organs, nerves, ligament, muscles together in one place. If fascia wouldn't have been there, then everything would be cross connection. So it's fascia which is holding organs aside from nerves aside from organs, muscles, skin, everything is being kept apart by the fascia. So when, if surgery is done at the abdomen level, the superficial front line, there will be a densification, rigidity, and it will contract. So once it will contract, it will pull all the other side organs and muscles together. So it's always, if you want to treat a patient, you need to treat all three systems, that is visceral, musculoskeletal, and neurological also, psychological also, because everything is connected. Yes,
Yes. So
sir.
many of the person are not comfortable with English, they are saying. So let me
Okay.
complete my presentation. Then we'll again
We'll have
take
question and
everything in
answer,
a
sir.
local language. Okay. Yeah. So people used to go through the recordings too. So we'll conclude this in a English first. Okay. Then here you can see the root cause healing session once again. So what we are going to cover: osteopathic cartilagation, IASTM, MFD, visceral. So all on these four aspects we are going to put a light on it. Nirusil will help us to understand the each and every therapy. So let me complete the details of the workshop. Such kind of certification you will get. So one certification is for bone setting and ISTM. One is for visceral manipulation, and another is the diploma in traditional bone setting, which is an optional certification. Those who are not having any kind of government valid certification can opt for this certification. So we have made a flexi learning mode for it, and the 1 year diploma of BSS Bharat Sevak Samaj, the diploma in traditional bone setting. So we have a provision to get it to you also. Get it by within a short period of time. We are going to cover all the syllabus, and these are some images of our previous workshops. Until now, we have trained more than 500 students through our workshops, and many of them are performing very well, earning very well, and we have lot of reviews on our YouTube also. You might have gone through some reviews. Will take here, so it will be on 3rd, 4th, and 5th Jan. So lock your date. So this is one video.
Hello,
That
sir.
came from the
So, how was your experience about workshop?
My experience was really great.
I expected something else. But here, all the faculties are so knowledgeable and they are able to answer our queries. And I can say that in spite of having done 42 courses, this has given me at least a 25% value addition to my knowledge.
Yeah.
Which is very important and which will be very useful for my patients, whom I can treat early and send them home.
Can you elaborate about your profession and experience, sir?
Yeah, I am Nagraj and I am a chiropractor and a manual therapist, and I also do acupuncture, tung acupuncture. I have a clinic in Hyderabad, Sainikpuri, Hyderabad, and I have done so far in last 5 years 7,000 odd patients I have treated, and yet every day we treat on an average between 25 and 30 patients in 4 hours session. We have a 9 to 1 clinic in that we treat. Apart from this, I do lots of service for the elderly people.
Yes. So as I described Sir's profile, he has been in this profession since several years, and he used to attend every single workshop. He find that I'll get something extra over there for chiropractic, whether it is from any Indian healer or foreign healer. But after such experience, when he come to our workshop, he find it very amazing. He said that I have never heard such kind of unique concepts, or if I am having the knowledge of all three systems, but I am not able to collaborate them for any pain. So these things you are going to learn. So you might have know the visceral manipulation, myofascial release, functional cupping, osteopathic articulation, but how to uh, collaborate all these things and identify the root cause, those things or those techniques we are going to see here with the live example. So this is the playlist of our students review.
So there is no doubt, but I have to speak. Can
So
I?
you can go through
Yes,
it.
ma'am,
I'll
definitely.
share the
You can
link
start
to
your video also.
Okay. Yeah. Hi. Hello, everyone. I'm Dr. Bhakti. I'm based in Pune. Please don't hesitate to do this course. It's an excellent course. Without any second thought, you can say it's a blindfolded eyes. You can go for this course. And really, I have accept these courses. I have also tried for the other courses. So after you, after baad, and really, there no one teaches like Ashish sir and their team. Without any second thought, really go, and it is really beneficial. You won't believe. Course करने के बाद, within a month we started our clinic. Within a month, 2 months we started our clinic, and per month we are earning 1 lakh.
Great.
Per month we are earning 1 lakh. It's directly cash, and patients are so satisfied.
this is
Right now, just
spontaneous
Rupesh sir said it.
review.
He
Okay,
within
in
you can
support
say
session he has given.
in 3-4 months the patients are getting really satisfied. Those who are having a problem since 8 years, 10 years, you can say even 24 years pain, 14 years pain, are they are getting it really. Right now the patients are calling. It's we are not waiting for the patients. Patients are calling us and they are booking an appointment, sir. And it's so you आपने हमारे हाथ में just you can say magic दे दिया. मतलब जिन लोगों को ऐसे फील होता है ना कि अरे वी आर नॉट वैलिड, हम कैसे इस कोर्स को करें. सो जो कोर्स हमें बाहर जाके करना जरूरी है, वो हमें अगर इंडिया में मिल रहा है, पूना में मिल रहा है और स्पेसिफिकली डिवाइन से मिल रहा है, तो प्लीज इसे कीजिए. मेक एंश्योर दैट यू डू दिस कोर्स. आई एम आल्सो कमिंग सर.
So ma'am is a doctor already, and she was working in a Pune, and now she has arranged a training camp too for especially for the foreigners in a Goa. So we are going to conduct that. So such kind of initiative also you can take, and we are there to back you, and we all can do the business and the healing together and make this mission happen. Okay, so this is another video I have.
So how indirectly the root cause or pain is, and in diagnosis you will get nothing, and it will be declared as a psychosomatic case and suggested to the psychiatrist. But what is the root cause we can see here?
In second-degree kidney ptosis, that continues its migration along the rail of the psoas. Under the practitioner palm, its inferior edge becomes more anterior and its external rotation is more obvious. As it further moves downward, it begins to irritate the ilioinguinal and iliohypogastric nerves, and, more rarely, the lateral femoral cutaneous nerve, all of which pass close to the layer of adipose tissue, which partially surrounds the kidney. Migrating kidney may also irritate the femoral and obturator nerves. The patient complains of cutaneous hypersensitivity or lower abdominal pain, which can radiate toward the labia majora or ipsilateral scrotum, or even the lateral thighs if the lateral femoral cutaneous nerve is affected. The results of conventional medical exams are typically negative, and the patient may be labeled as a hypochondriac. Tension on these vessels by the external rotation of kidney create vascular spasm. The external rotation of kidney can also stress and twist the ureter, often manifested as abdominal tension appearing about 15 minutes after drinking. We believe this can also be a factor in the development of kidney stones. Get your kidney checked for ptosis and correct it with visceral manipulation technique.
Yes. So in that video, we have seen the problem was in a kidney, but pain symptoms are in a thighs, at scrotum, in a leg or back. But the root cause was kidney, and in reports, everything is coming negative. So reports are not able to diagnose these. So how to treat those things? We don't have any right to do permutations and combination on anyone's body. So we have to identify these things, and through the immense experience and having a people like Neeraj sir, we are going to address these issues. And it is too excited. You will be too excited after the session to treat the people, and we'll also guide you uh, during the sessions how you can market yourself. Within a 3 days you will have appointments in your hand, and on a fourth day only you will go and do the patients. So these marketing things also we will teach you and guide you. And those who are performing well, asking questions regularly, submitting their videos, we give you opportunity to work together to take a franchisee. We also send our team to your place to organize the health camp. They used to treat the hundreds of patients within few days, and all those patients will come for the follow-up to your OPD, so that your centers get on the wheels. Okay, so this way also we support each and every our students. So Mission Hargar will now get all manual therapies under one roof in a single workshop from the best. So from which we are learning, this is the most important thing.
So this become most.
My sound is okay? Or it is coming lower than previous? Okay. So we have to diagnose the root cause. So you might have seen my ad that I have clearly told that think on a faculty which are going to teach you, whether they are able to diagnose the root cause, they are able to read the MRI, or they are having the knowledge of various modalities. So it is necessary to check for that and then only enroll for the course. So I am tried to bring the best under one roof. Okay. Yes. So the posture, what is the kinetic chain, and what is assessment, everything we are going to cover. We have a recorded lectures also for this. As you register for the course, we are we have we start to provide you lectures of 1 hour, 2 hours regarding this. So before you join the workshop, you will completely understand the theoretical part, and then we'll go for the practical one. So as early as you register for the course, you will get more time to do the homework. Okay. So from the feet to cervical, all corrective protocols we are going to cover. So 3 days hands-on skill workshop and followed by 2 months online sessions and mentoring. So it is from 3rd to 5th January 2025. So this will be a gift to yourself on this new year, and the best practice you are going to start as a career. So including following development of holistic approach to see the problem with the view body is one unit. So this is most important, to keep the view that body is one unit. Okay, so there is a connection of your feet to your skull, or your nails, feet nails to your hairs. So everything is connected. Okay, so visceral also have a fascia surrounding it. So that fascia is also have a very crucial role in the metabolism. So how it is connected to anything, how your eyes are connected to your feet. So that amazing things we are going to learn and understand the concept. So understanding the connection between all three systems of skeletal, muscle, visceral, body posture analysis, root cause identification with counseling and test, bone setting and osteopathic articulation techniques for spine, joint, mobilization and manipulation too. Okay. Then understanding radiology terminologies, contraindication, red flags, understanding the use of direct and indirect techniques, assessment diagnosis, healing protocols for various cases. So for various cases, we'll provide you various protocols too. You just have to follow them. And understanding the muscle chains, their functions with skeletal system, muscle chain release protocol, IASTM instrument assisted soft tissue mobilization, myofascial decompression by functional cupping. Then visceral organs and their functions and their connection with whole body. Identification of similar pain of visceral and musculoskeletal. So this is most important. So what kind of pain? Pain will be the same. The pain will be in a leg or in a thigh. But is it due to the musculoskeletal issue or due to the visceral? That variations you will come to know in this session. So increasing mobility and functionality of organs associated with musculoskeletal health issues. Okay, then visceral massage therapy with hands on practicals under observation of mentor. Then how to start therapy center, rules and regulations for it, things we should not do or claim to the customer, about valid certifications and current scenario of this therapy. Then marketing and business development strategies, career options in collaboration or franchisee with Divine Touch, use of advanced free digital marketing tools for promotion, strategies to spread awareness about your skill in your surrounding society, village, city, etc. So these things also we are going to guide you. So if we go for the training fees, so total training fee is 37,500 for all three protocols you are able to learn, and it is not more than the 10% of the fees what we have spent to learn these protocols. Okay, what you have to spend when you go for the international courses. Okay, so for especially for non-medicals, it is a very good opportunity that you are going to understand this kind of manual medicine concept. First of all, you will never heard about these things, and if you heard by chance, you will never get admitted to any such kind of course. So we have made it simplified for you. Just go for it, understand the things, and apply it as suggested, as taught, and you will see the amazing results. On yourself, you will see first in a workshop, and then you will deliver to society too. So these fees we have discounted this new year to the 31,500 directly, and it includes your residence in a resort, food, and everything. So you can re-attend workshop again in next 6 months. If you want to re-attend the workshop, you can attend in a free within next 6 months for any batch. And if someone want to do a more practice, you can stay for one more day and practice at our centers too in Nasik. But I'll guarantee you that on the day 3, you will be much ready to work directly on the patients, because there you are going to practice each and every step, at least on a 9 people. So when you perform a single step on 9 different bodies, you will understand the concept, and there will be a mentor with you. We will never leave you alone for the practice. Mentor will always there with you. So for 3 groups, there will be a 3 mentor near your beds, and they are keep on guiding you about the position and everything. So during the practice, in lot of manual therapy workshop, we have observed that we come to know that the lot of injuries had been happened. So these things will not going to happen in this workshop. Okay, so 2 certifications by NIPS Paramedical College and Divine Touch you are going to get. And those who are freshers and want to apply for the diploma certification of BSS have to pay additional 7,500 rupees to paramedical college after 1 month of completion of workshop. And so they will be awarded with the additional certification of diploma in traditional bone setting by NIPS college. Okay, and we have now organized to give you a World Skill Council registration certification too after taking this diploma. So after taking this diploma, you have to submit your practice videos and customers reviews for next 3 months, and after that you will become eligible, and we are keep on guiding you, so you will become eligible uh, uh, for the affiliation or certification of World Skill Council. So that provision also I have made recently last week. So for the registration, you have to pay advance 9,000 rupees for admission. Remaining you can pay and on the spot. As you pay for the registration, you will get anatomy, physiology, and other lectures too. As you complete one lecture, uh, ask to your supporting person. He or she will keep on posting you the next lectures. Okay. Then discount scheme. So it is early bird discount. So pay by 10th of December. So fees will be 30,000. Instead of 31,500, it will be a 30,000. And it already gone because I have conducted the last one webinar too. But for this webinar, we are going to retain this offer of 30,000. So ladies, lazy bird discount is going on now, 30,500. And angry bird will be after 25th, so it will be a 31,000, and those who are coming after 25th, there will be a no discount for you. Okay, so you have the opportunity to grab your to earn your discount. Someone may think that I'll discuss with sir personally, discuss with team personally, ask for a discount. So instead of asking for the discount, it will be a same for all. You can earn your discount by helping us to grow our mission. Okay, so for every individual candidate you refer, you will get a flat 5% discount or cashback on the amount of fees what that candidate has had paid. Okay, so an additional discount also available if you are coming in a group, you are referring to your friends. So if there is a group more than 3, so with the referral cashback, you are eligible to get additional cashback too. Okay. So now in this webinar, if you have to confirm your seat, because we have a limited seats, we have a 25 seats reserved for new candidates and 5 seats reserved for our old students, those who want to re-attend the session. Okay, so within that 25, I think already 15 to 18 registration had been confirmed, and many of are in a channel to give the confirmation. So book your seat fast, and if the 25% get over, because we have a resort and limited accommodation we have over there, on our center we have a good hall, we can collaborate 30-35 people also there, but on this training we have organized on a resort. So do your registration first, and now you have to pay 2000 rupees only on the same number, or the QR you can see in front of you, you can take a screenshot of it. Okay, so I'll share it on a group too, but uh, within a webinar you have to make payment, so you are eligible for the fees of 30,000, and within, when you pay the 2000 rupees, immediately you will get a kinetic lecture on a kinetic chain of a body and how body is one unit and what we are going to exactly address. So that experts 2 hours lecture you will get immediately. Okay, and the pending fees of rupees 7,000 you have to confirm within next 2 days. If you want some more clarification, you can discuss with our staff or our experts. You can ask to connect with them. You will you make your queries so resolved, and then you can pay the remaining amount of 7,000. Okay, so this is the what the presentation, and now we'll focus on the Q&As, and it is open for all of you to ask the question. Kindly put your questions in a chat. I will now allow everyone to see the chat. Okay, so put your questions in a chat. Neeraj sir will address the questions, and if someone have a question and want to talk, kindly raise your hand. We'll unmute you and you can talk. Yes, Neeraj sir, you want to guide something? You can guide, sir.
Yes, sir.
I'll share the
So,
payment link in a group.
if anyone is having any doubts or queries, they can ask. Let's make an interactive session. So, anyone? Anyone having any questions? Any doubt?
Sir, you explain in Hindi
Yeah.
what we are going to cover in a workshop, and I have one video for that. I'll play it also within few minutes.
किसी को कोई डाउट, कोई क्वेश्चन है, कोई क्वेरी है, वो पूछ सकता है। या 3 दिन हम क्या सीखने वाले हैं, क्या सिखाने वाले हैं। तो ये 3 दिन में जो है हम रूट कॉज को ट्रीटमेंट 2 तरीके होती है। एक सिम्टम को ट्रीट करो और दूसरा रूट कॉज को ट्रीट करो। तो इस 3 दिन में हम रूट कॉज को कैसे ट्रीट करते हैं, उसके लिए क्या क्या करना पड़ता है, वो हम सीखने वाले हैं।
Hi sir, this is Vishal Dubey from Mumbai. Hello, Neeraj sir. Sir,
Yes,
hello.
sir. Yes, sir, please.
Are you able to understand Hindi ना sir?
Yeah, sir. बोलिए सर।
सर एक्चुअली मैं पिछले 3 सालों से लाइक टेपिंग, IASTM, मसाज ये सब मैं करता हूँ, ठीक है। मुझे
Yes.
खाली ये जानना है कि ऑस्टियोपैथी और कायरोप्रैक्टिक दोनों में क्या डिफरेंस है?
कायरोप्रैक्टिक ये ऑस्टियोपैथी का एक ब्रांच है।
ओके।
कायरोप्रैक्टिक बेसिकली स्पाइन पे काम करता है, सिर्फ स्पाइन पे। और ऑस्टियोपैथी ओवरऑल बॉडी यूनिट पे काम करेगा। वो आपके विसरल पे भी काम करेगा, आपके मस्कुलोस्केलेटल पे भी काम करेगा, आपके न्यूरो साइकोलॉजिकल पे भी काम करेगा, क्योंकि एवरीथिंग इज कनेक्टेड। कायरोप्रैक्टिक में जो है आप सिर्फ जो है स्पाइन पे ट्रीट कर सकते हो, उसमें विसरल को ट्रीट नहीं करोगे। लेकिन 80% आजकल जो यूनिवर्सल प्रॉब्लम है बैक पेन का, इट इज कनेक्टेड टू ब्लोटिंग। अगर यहाँ पे हमेशा ब्लोटिंग फील रहेगा या कॉन्स्टिपेटेड रहेगा, एक्सेस हवा भरेगी तो वो पीछे स्पाइन को इम्पैक्ट करेगी।
हाँ, ये तो पता था मुझे, सॉरी जी।
तो कायरोप्रैक्टिक में, और कायरोप्रैक्टिक जो सब आप यूट्यूब पे इंस्टा पे देख रहे हो ना, वो कायरोप्रैक्टिक है ही नहीं।
हम्म
कायरोप्रैक्टिक भी एक, कायरोप्रैक्टिक में एक प्रिसाइसनेस होता है, जो थ्रस्ट होते हैं वो HVLA
हम्म
टेक्निक होती है, LVLA टेक्निक होती है। हाई वेलोसिटी लो एम्पलीट्यूड थ्रस्ट होता है, लो वेलोसिटी लो एम्पलीट्यूड थ्रस्ट होता है। और जो यूट्यूब पे सोशल मीडिया पे आजकल जो कायरोप्रैक्टिक बताया जा रहा है ना, वो जो है वो
हम्म
कायरोप्रैक्टिक नहीं है, वो HVHA है, हाई वेलोसिटी हाई एम्पलीट्यूड थ्रस्ट, जिसकी जरूरत नहीं है। कायरोप्रैक्टिक जो है ये ट्रेडिशनल इंडियन बोन सेटिंग, ये पुराने जमाने में एंशियंट टाइम से हमारे में चल रहा है। लेकिन इसका रिसर्च R&D उस पे यूरोप कंट्रीज में, फॉरेन कंट्रीज में हुआ। तो उसका कायरोप्रैक्टिक का जो ट्रीटमेंट का जो बेस है वो तीन चीजों पे चलता है। फर्स्ट इज सबलक्सेशन प्रॉब्लम, सेकंड इज फैसेट जॉइंट प्रॉब्लम, थर्ड इज डिजनरेशन प्रॉब्लम। तो ये करना, असेसमेंट करना, यही सबसे बड़ा इंपॉर्टेंट पार्ट है। हमारे यहाँ पे आप यूट्यूब पे, इंस्टा पे, सब जगह पे आजकल कायरोप्रैक्टिक के वर्कशॉप भी हो रहे हैं। उसमें आप देखोगे कि आपको सिर से लेके पैर तक सब कुछ क्रैक करना सिखाते हैं। पेशेंट आया, उसका गर्दन भी क्रैक करो, उसका हाथ भी, एल्बो भी, नाक भी, जाते जाते फ्री में कान भी कर दो, घुटने भी कर दो, कमर भी कर दो, पैर भी कर दो, एल्बो भी कर दो, रिस्ट भी कर दो, सब कुछ कर देते। लेकिन सच में जरूरत है क्या? वो काइनेटिक चेन कहाँ पे बायोमैकेनिक्स गलत हो रहे हैं, वो फैसेट जॉइंट प्रॉब्लम है या सबलक्सेशन प्रॉब्लम है, डिजेनरेटिव प्रॉब्लम है। और बार बार, ऑलरेडी कायरोप्रैक्टिक जो है ये हमारे इंडियन बॉडीज के लिए ज्यादा बना ही नहीं है। ऑलरेडी हमारा इंडियन बॉडी स्ट्रक्चर जो है वो हाइपोमोबाइल है, हाइपो फ्लेक्सिबल है। सो अगर आप बार बार मैनिपुलेशन करते हो तो आप वो जॉइंट में इन्फ्लेमेशन क्रिएट करते हो। तो उसके लिए आपको रूट कॉज को अगर ट्रीट करना है तो ट्रीटमेंट, कोई भी चीज ओवर अगर हम करेंगे तो उसका निगेटिव इम्पैक्ट ही बॉडी पे गिरेगा। तो आपको
एग्जैक्टली।
पिन पॉइंट और प्रिसाइसनेस जो हम बोलते हैं ट्रीटमेंट के लिए, वो होना जरूरी है। और आपको जो 3 दिन में हम जो सिखाते हैं, हम एज एन थेरेपिस्ट या डॉक्टर, जो हम हमारे पेशेंट को ट्रीट करते हैं जिससे हमको रिजल्ट मिला है, हम ये अलग अलग जगह पे अलग अलग वर्कशॉप्स कर करके एक्सपीरियंस लेके और ट्रायल एंड एरर बेसिस पे जो हमारे पेशेंट को हम रिजल्ट ओरिएंटेड हमको जो टेक्निक्स लगी, अभी उन सब का क्लबिंग करके हम आपको वही जो चीज है हम आपको सिखाते हैं। मैंने सबसे पहले एक जैसे वेबिनार शुरू हुआ, मैंने एक सवाल पूछा था कि विच इज वन ऑफ द मोस्ट इंपॉर्टेंट पार्ट ऑफ आवर बॉडी। तो सबने, किसी ने सर बोला, किसी ने हार्ट बोला, लंग्स बोला, लीवर बोला, XYZ बोला। लेकिन वन ऑफ द मोस्ट इंपॉर्टेंट पार्ट ऑफ आवर बॉडी इज आवर फीट्स। अगर फीट आर फाउंडेशन ऑफ आवर बॉडी, यहाँ पे आप देखोगे आपके फीट में अगर इम्बैलेंस है, आपका पोस्चर क्यों काइफोटिक हो गया है, फॉरवर्ड नेक पोस्चर, राउंडेड शोल्डर क्यों हो गया है? क्योंकि आपका पैरों का जो आर्च है वो लो है। अगर फ्लैट फीट है, लो आर्च है, तो आपका फीट मीडियली कोलैप्स होगा। सो उसके लिए हिप को एक्सटर्नली रोटेट होना पड़ेगा। तो ग्रेविटी मेंटेन रखने के लिए आपका पेल्विस एंटीरियर शिफ्ट होगा, फिर उसको मेंटेन रखने के लिए आपकी शोल्डर राउंडेड हो जाएंगे, तो नेक फॉरवर्ड हो जाएगा। तो ये सारे चीजें जो ये बायोमैकेनिक्स, क्योंकि हम खड़े किस पे रहते हैं? पैरों पे खड़े रहते हैं। हम चलते किस पे है? पैरों पे चलते हैं। हम बैठते किस पे है? पैरों पे बैठते हैं। तो एवरीथिंग इज कनेक्टेड टू फीट। मैकेनो रिसेप्टर जो है सेंसरी इंफॉर्मेशन, वो हमारे पैरों से ब्रेन में जाएगी, ब्रेन से बॉडी में पास होगी। सो फीट आर वन ऑफ द मोस्ट इंपॉर्टेंट पार्ट ऑफ आवर बॉडी, और वहीं पे हम ध्यान नहीं देते हैं। बैक पेन है, नेक पेन है, स्कोलियोटिक है, काइफोटिक है, लेकिन क्यों है? क्योंकि
हम्म
फिट में
फिट
इम्बैलेंस
इन
है।
बैलेंस।
क्यों का जो सवाल है, अभी आप IASTM करते हो, टेपिंग करते हो, राइट? टेपिंग क्या हो गया?
यस।
आपने सपोर्ट देने के लिए, उसको स्ट्रेंथ या मसल को सपोर्ट देने के लिए आपने टेपिंग लगा दी, बराबर? लेकिन वो मसल पुल क्यों हुआ है, या उसको स्ट्रेंथ कम क्यों हुई है, या उसको सोरनेस क्यों डेवलप हुआ है, प्रॉब्लम क्यों हुआ है, कहीं पे भी तो उसका बॉडी का बायोमैकेनिक्स वो गलत है, जिसकी वजह से जब प्रॉब्लम होता है तो इट्स ऑलवेज वन साइड इज ओवर वर्किंग, अदर साइड इज अंडर वर्किंग. सो
ओके सर.
वन विच इज वर्क ओवर वर्किंग वो प्रॉब्लम रहेगा. तो हम क्या करेंगे, ओवर वर्क जो करती है उसको ट्रीट शुरू कर देंगे. लेकिन प्रॉब्लम ओवर वर्क का नहीं है, प्रॉब्लम अंडर वर्क का है. एक साइड मान लो लेफ्ट साइड अंडर वर्क कर रही थी, इसीलिए राइट साइड पे ज्यादा प्रेशर जा रहा था. दैट इज वाई राइट साइड इज पेनिंग. सो हमको राइट लेफ्ट को एक्टिवेट करना है, तो ऑटोमेटिक राइट को प्रेशर कम हो जाएगा. तो ये सारी जो चीजें है, ये हम जब प्रैक्टिकली कुछ चीजें की है हमने, तो यहाँ पे आप देखोगे कि फ्लैट फीट है. अगर फ्लैट, क्योंकि हमारे बॉडी का शॉक अब्सर, फर्स्ट शॉक अब्सर सिस्टम हमारा आर्च होता है, जो पैरों में आर्च होता है वो. अगर वो पहला शॉक अब्सर सिस्टम काम नहीं करेगा तो हमारे बॉडी का सेकंड शॉक अब्सर सिस्टम है हमारा पेल्विस, उस पे प्रेशर आएगा. जब वो काम नहीं करेगा तब नी पे प्रेशर आएगा. सो नी पेन, बैक पेन, ये सब
यस.
क्यों है? क्योंकि फिट में इंस्टेबिलिटी है. एवरीथिंग इज कनेक्टेड टू फिट. आपका कोई भी प्रॉब्लम हो, आप इरेक्टाइल डिसफंक्शन ले लो, प्री मैच, आप इनफर्टिलिटी ले लो, पीसीओएस, पीसीओडी, लीवर के प्रॉब्लम, किडनी के प्रॉब्लम, ये सब क्यों हो रहे? क्योंकि जब आप ऑस्टियोपैथी में आओगे, ऑस्टियोपैथी पढ़ोगे, तब उसमें समझ में आएगा कि एवरी ऑर्गन हैज इज डेजिग्नेटेड मूवमेंट. हर एक ऑर्गन जो है वो एक डेजिग्नेटेड मूवमेंट होती है. किडनी जो है वो 24 घंटे में 600 मीटर डिस्टेंस कवर करती है, अप एंड डाउन, अप एंड डाउन. हम ब्रीद इन ब्रीद आउट करते हैं, रिब जब फ्लेयरिंग हो गए तो अप जाएगा, आउट करोगे तो वो डाउन आएगा. अभी अगर मेरा काइफोटिक पोस्चर हो गया तो किडनी को मूवमेंट करने के लिए जगह ही नहीं है, तो उसका किडनी से रिलेटेड जो भी फंक्शन है वो एबनॉर्मली होंगे. और कोई भी स्कैनिंग में, सीटी स्कैन, एमआरआई, 2D, 3D, या कोई भी आप स्कैन करा लो, किसी भी स्कैन में ऑर्गन की मूवमेंट नहीं आती है, मोबिलिटी, मोटिलिटी नहीं आती है. वो आपको कब पता चलेगा? जब आप फिजिकली आप पैल्पेट करोगे, तभी आपको पता चलेगा. सो जब पोस्चर में प्रॉब्लम होगा तो उसके अंदर के ऑर्गन में भी प्रॉब्लम होगा ही होगा. तो इसीलिए इट्स ऑलवेज क्यू. अगर पेशेंट आपके पास आ रहा है कि उसका एल्बो पेन हो रहा है, तो एल्बो पेन हो रहा है वो ठीक है, हमारा फोकस क्या होना चाहिए, एल्बो पेन क्यों हो रहा है. पेशेंट आ रहा है आपके पास नी पेन का, तो आप
सर
क्या करोगे?
वो जो वीडियो हमने किडनी का दिखाया, किडनी टोसिस का, वो वही था ना कि रिपोर्ट में
यस,
कुछ
यस,
नहीं आया, बराबर, बट
यस,
प्रॉब्लम, हाँ पेन था, बट प्रॉब्लम था कहाँ पे? किडनी में था. और उसके पेन जो है वो रेडिएट हो रहे थे आपके मसल्स में. सो वैसे ही सियाटिका का सिम्टम रहता है, बट 40% केसेस में वो विसरल इश्यूज की वजह से रेडिएट होता है, और वैसे ही
आपने
फुलर
अच्छा
शोल्डर का
टॉपिक
होता है.
निकला है, सीआरटी का. आजकल सीआरटी का एक फैशन हो गया है. आजकल हर आपको वो 10 साल के, 15 साल के बच्चों के मुंह में भी सीआरटी का वर्ड सुनाई देगा. ये एक फैशन हो गया आजकल कि मुझे सीआरटी का है, मुझे सीआरटी का है. सीआरटी का मतलब कोई बीमारी नहीं है.
सॉरी.
सीआरटी
सॉरी नीरज सर. सॉरी.
यस सर.
हेलो हेलो.
जी सर.
सॉरी टू इंटरप्ट यू सर. एक्चुअली जैसे मैं 3 साल से पिछले प्रैक्टिस कर रहा हूँ, तो यहाँ पे बहुत सारे जो पेशेंट है जो बोलते हैं कि मैं साइटिका से सफर कर रहा हूँ या ये कर रहा हूँ, तो मैं इजिली उनको आईएसटीएम अप्लाई करके और उनका मसल्स रिलीज करता हूँ, तो उनको बहुत हद तक बेनिफिट हो जाता है.
हाँ.
बहुत,
ये
मतलब
तो आपने
आपको मैं बोलूँ कि वो
ये
लोग
तो
बोलते हैं कि
ये तो आपने दिल की बात छेड़ दी सर. हम यही तो कन्वे करना चाहते हैं ना कि सीआरटी, समझो उसको सीआरटी का ही है, तो जरूरी नहीं है उसके
हाँ,
कमर को मोड़ने का, तोड़ने का, बराबर.
वही वही वही.
हाँ,
और आप
तो
बिलीव
हम
नहीं
लोगों को वही
करोगे,
लगता है.
मैं शॉक्ड हो जाता हूँ. मेरे पास अभी कुछ समय पहले एक पेशेंट आया था, वो इंडियन नेवी का बास्केटबॉल. उसके पास अच्छे skills है, तो वो लोग उसको ट्रीट नहीं कर पा रहे थे, और मैंने उनको रिलीज करके वो ट्रीट कर दिया, और वो पेशेंट इज वेरी हैप्पी राइट नाउ.
यस यस.
इनफैक्ट ही नॉट एबल टू बेंड फॉरवर्ड, कि उसको इतना टाइटनेस था उसके बैक में. तो बोला कि ऐसा तो मुझे कोई एक फिजियोस नहीं कर पाया, आपने रिलीज कर दिया। मैं बोला कि उन्होंने काम नहीं किया होगा उस चीज से।
तो यही डिलीवर करना है।
सॉरी सर, यू कंटिन्यू।
यस यस, ओके।
एनीवन और किसी को कोई डाउट और क्वेरी होगा? सवाल पूछिए सर, आप जो भी है आप सवाल पूछो तो मजा आएगा, थोड़ा इंटरेक्शन होगा तो मजा आएगा।
अभी डिवाइन टच का मैं बताऊँ तो रिसेंटली हमने ग्लोबल योगा समिट 2025 में, जहाँ पर 27 कंट्रीज से डेलीगेट्स आए थे, वहां पे भी हमने
57 नहीं सर, 50।
57।
57 कंट्रीज से डेलीगेट्स से।
So Neeraj sir has represented Divine Touch this year. Last year I have represented. So the every year when we go for the presentation, there will be a unique and untouched topic. Okay. So and this here you can see we have conducted a corporate wellness service camp at Crompton, and recently we have completed in Mahindra and Mahindra, Thyssen Krupp, and now we are going to conduct in a Samsonite, and now we are focusing on IT industries too. So in that we used to get customers in a bulk, and to conduct these camps we used to invite our well performing students too, and we can do all this for you in your city too. If we get a confidence that you become a genuine healer, we can refer anyone to you, and you will not play with anyone's of health. Okay, so these things also we have. I'll share one video.
बहुत सारे मैसेज आ रहे हैं मुझे कि सर मैं नॉन मेडिकल हूँ, मेरा ये प्रोफेशन है, क्या मैं ये वर्कशॉप कर सकता हूँ क्या? तो मैं यहाँ पे ये स्पेसिफाई करना चाहता हूँ कि डिवाइन टच हीलिंग सेंटर जो है या फिर डिवाइन टच ये जो संकल्पना है और जो वर्कशॉप हम चला रहे हैं मैनुअल मेडिसिन के लिए, इसका उद्देश्य ही यही है कि हमें नॉन मेडिकल्स को ये हीलिंग के करियर में लाना है। और यहाँ पे एक बहुत बड़ा अपॉर्चुनिटी है दोस्तों, क्योंकि ये आने वाले समय में या अभी भी आप देखेंगे तो डिमांडिंग फील्ड है और वेलनेस के ऊपर लोगों का ज़्यादा अभी ध्यान है। एंड प्रिवेंशन इज बेटर देन क्योर, सो ये प्रिवेंटिव अप्रोच लोगों में डेवलप होते जा रहा है। और डिवाइन टच ये एकमात्र ऐसा इंस्टीट्यूट रहेगा कि जहाँ पे आप सभी मैनुअल थेरेपीज को अंडर वन रूप सीख सकते हैं। और स्पेशली नॉन मेडिकल्स के लिए तो ये प्रोटोकॉल आपको कहीं पे सीखने भी नहीं मिलेंगे और जानने के लिए भी नहीं मिलेंगे, लेकिन ये यहाँ पे आप एक्सपीरियंस कर पाएंगे और आपको समझेंगे ऐसी भाषा में हमने इसे डेवलप किया है। तो ये खूबसूरती है हमारे प्रोग्राम की। तो मैं हर एक को वेलकम करता हूँ। और यहाँ पे हम क्या कर रहे हैं कि कोई भी प्रॉब्लम है उसके जड़ तक हमें जाना है। तो जड़ तक हम कब जा सकते हैं कि कोई भी पेन है उसका रिलेशन, जैसे मैंने वेबिनार में भी बताया था कि उसका रिलेशन आपके मस्कुलोस्केलेटल से तो है, लेकिन साथ में विसरल से भी होता है। तो एग्जैक्टली ये इशू कहाँ से अराइज हो रहा है वो आइडेंटिफाई अगर करना है तो एक ही पर्सन को मसल के ऊपर, स्केलेटल सिस्टम के ऊपर और विसरल सिस्टम के ऊपर काम करते आना जरूरी है। दूसरी बात, ये तीनों चीजें अगर आप सीखने जाएंगे अलग अलग तो जो पैसा आज के डेट में मार्केट में लगता है उसके 10% में ही मैं ये सब डिलीवर कर रहा हूँ। और दूसरी बात, आपने लाखों रुपया खर्चा करके ये सीख भी लिया तो भी क्या हो जाएगा कि ये सब का सिंक्रोनाइजेशन लगाना बहुत मुश्किल हो जाएगा। कि मैंने विसरल मैनिपुलेशन भी सीख लिया, मायोफेशियल रिलीज भी सीख लिया, मैंने बोन सेटिंग, स्पाइनल अलाइनमेंट भी सीख लिया, लेकिन अगर कोई केस मेरे सामने आता है तो ये तीनों का आपस में कनेक्शन क्या है कि एग्जैक्टली ये जो पेन सिम्टम है ये सियाटिका पेन है कि कोई विसरल के वजह से है, या ये मसल पेन है कि किडनी डोसेस के वजह से पेन अराइज हो रहा है। सो ये लीवर के फेशिया के वजह से ये सिम्टम्स आ रहे हैं कि एग्जैक्टली सच में ये शोल्डर से रिलेटेड ही पेन है। तो ये सब चीजें है ना, यहाँ पे आपको कोई भी तुक्का नहीं लगाना है, बराबर। पेशेंट के हेल्थ के साथ कोई खिलवाड़ ना करते हुए हमें रूट कॉज को आइडेंटिफाई करते आना जरूरी है। तो यहाँ पे हमने क्या किया है, हमारे एक्सपीरियंस से हमने आपके लिए स्पेशल प्रोटोकॉल्स डेवलप किए हैं जो आपको डिवाइन टच के अलावा बाकी कहीं नहीं मिलेंगे। और वो अप्लाई करने के बाद इतने अमेजिंग रिजल्ट आपको आएंगे। सब सेफ एंड इनडायरेक्ट टेक्निक्स रहेंगी। मैं टेस्टिमोनियल्स भी मेरे पास बहुत सारे हैं कि मेरे बहुत से स्टूडेंट जो नॉन मेडिकोस थे या फिर कोई हेल्थ केयर जैसे मसाज थेरेपिस्ट है या जिम ट्रेनर है या नर्सिंग का प्रोफेशन है या फिर डिप्लोमा इन फार्मेसी हुआ है, तो ऐसे भी लोग आए और वो इतना बढ़िया काम कर रहे हैं कि उसमें कुछ उदाहरण तो ऐसे है कि 3 से 4 महीने में उनका जो मंथली रेवेन्यू है वो 1.5 से 2 लाख रुपए तक लेके गए हैं। जैसे डिवाइन टच का भी आप देखेंगे तो हमने जब शुरुआत किया था, हमने फ्री कैंप से शुरुआत किया था, देन वी हैव यूज टू चार्ज द 100 रुपीज ओनली, और वहां से लेके अभी हमारा रेवेन्यू को जो हम 3 से 4 लाख रुपए तक लेके गए हैं, तो ये आपके सामने एक लाइव एग्जांपल है कि कैसे ये बिजनेस में भी सक्सेसफुल हो सकते हैं और नॉन मेडिकोज भी किस प्रकार से इसमें काम कर सकते हैं। और जैसे आपका जेस्ट है, जैसे हमारा स्ट्रेंथ है कि इनवेलिंग जेस्ट टू हील मैनकाइंड, तो यही जेस्ट के साथ अगर आप काम करते हो तो डिवाइन टच आपको लाइफ टाइम मेंटरशिप तो देता ही है, साथ में आप जितना स्टडी करना चाहते हो उतना एडवांस चीजें भी आपको प्रोवाइड करते रहता है। उसके बाद में हैंड होल्डिंग सपोर्ट हमारा है। बहुत से लोग ऐसे है कि जो ऑलरेडी कायरोप्रैक्टिक करते हैं, ऑस्टियोपैथी करते हैं, लेकिन ये हैंड होल्डिंग सपोर्ट के लिए या फिर जो मिरेकुलस रिजल्ट हम कॉज करते हैं वो जानने के लिए सिर्फ वो अपने कोर्स में एडमिशन लेते हैं। तो ये सब बहुत सारी अपॉर्चुनिटीज है दोस्तों यहाँ पे। तो शॉर्ट में इतना ही, बाकी मेरे वेबिनार में तो मैं कवर करने ही वाला हूँ। तो हमारी अपकमिंग जो भी बैच है उसके लिए आप जल्द से जल्द रजिस्टर कीजिए। और हमने क्या किया है कि नासिक में ही हम जो है ट्रेनिंग कंडक्ट करते हैं। यहाँ पे आपको हम प्रॉपर रिसोर्सेज दे पाते हैं, प्रॉपर टूल्स हम अवेलेबल कर सकते हैं, प्रॉपर प्लेंटी ऑफ टीम मेंबर्स यहाँ पे रहते हैं। तो एक अच्छा यहाँ पे सेशन होता है। और दूसरा, हम रेसिडेंशियल कैंप अभी हम जो है रख रहे हैं। तो इसमें हम एक रिसोर्ट का प्रॉपर्टी हमने बुक किया है जहाँ पे ट्रेनर भी आपके साथ रहेंगे 24/7, जिसका फायदा ये होगा कि मैक्सिमम से मैक्सिमम टाइम आप उनके साथ रह के उससे और ज्यादा निचोड़ हम ले सकते हैं। तो इस कैंप को ऑर्गेनाइज करने के लिए आपका इसमें पार्ट होना बहुत जरूरी हो जाता है, बिकॉज इट इज अ चैलेंजिंग भी हम बोल सकते हैं कि ये ऐसा एक फील्ड है, ऐसी एक राह है जिसमें मेरा जो मिशन है कि मिशन हर घर हीलर, कि हमें हर एक घर में एक हीलर डेवलप करना है और ये होलिस्टिक हीलिंग अप्रोच वहां पे लेके जाके हमें कम से कम अगले 10 साल में 5,000 हीलर्स की टीम और 2 करोड़ लोगों को पेन फ्री लाइफ, होलिस्टिकली हील्ड लाइफ प्रोवाइड करना है। सो इस मिशन में आप सहयोग देंगे, आइए जुड़ते हैं और इस ट्रेडिशनल हीलिंग को घर घर में पहुंचाते हैं। धन्यवाद।
Yes. So anyone want to unmute and discuss? We are available for next 10 minutes. So this is the resort, picture of resort we have booked. So, and it is very quiet place near the Trambakeshwar. You are going to experience the nature too here. And this is our ad, what we are running on a FB. You might, many of you might have not seen this. So let's go through this landing page. Earn more, heal from the root cause, make lasting impact on society.
नमस्ते।
मैं आशीष सूर्यवंशी, डायरेक्टर ऑफ डिवाइन टच हीलिंग सेंटर। क्या आप ट्रेडिशनल बोन सेटिंग में करियर करना चाहते हो तो डिवाइन टच हीलिंग सेंटर और NIPS कॉलेज ऑफ पैरामेडिकल एंड नेचुरोपैथी आपके लिए लेके आ रहा है डिप्लोमा इन ट्रेडिशनल बोन सेटिंग वर्कशॉप। सो ये 3 डेज का हैंड्स ऑन वर्कशॉप रहेगा, फॉलोड बाय 2 मंथ्स ऑनलाइन सेशंस। तो इसके बारे में डिटेल जानकारी के लिए आप मेरे अपकमिंग वेबिनार में मुझे ज्वाइन कर सकते हैं। ज्वाइन करने के लिए आप नीचे दिए गए बटन पे साइन अप कर सकते हो। अभी इस वर्कशॉप में हम क्या सीखेंगे, इसमें अगर आप पेशेंट पे काम कर रहे हैं या फिर पेशेंट का स्पाइन अलाइन करने का आप ट्रेनिंग ले रहे हैं तो कौन सी फैकल्टी आपको सिखा रही है, वो टेक्निकल फैकल्टीज है क्या एक्सपीरियंस उनको है, सिर्फ आवाज निकालने से काम बनता है क्या, रूट कॉज ट्रीट करने के लिए कैसे मस्कुलोस्केलेटल सिस्टम को टारगेट करना है, पोस्चर एनालिसिस का प्रोटोकॉल हमें कैसे डिजाइन करना है, इनडायरेक्ट मैनिपुलेशन टेक्निक की यूज से हम अपने प्रैक्टिस को कैसे सेफ बना सकते हैं, प्रैक्टिस करने के लिए क्या रूल्स एंड रेगुलेशन आपके हो सकते हैं, मेडिकोज है नॉन मेडिकोज है उनके लिए रेड फ्लैग्स क्या रहेंगे, कौन से पेशेंट को हमें अटेंड करना है और कौन से पेशेंट को हमें रेफर करना है, रेडियोलॉजी रिपोर्ट अगर पेशेंट लेके आता है तो उसमें से कौन सी टर्मिनोलॉजी अगर हमारे सामने आती है तो फिर हमें क्या प्रोटोकॉल जो है वो यूज करने हैं। ये सब चीजों पे डिस्कशन और विथ एग्जांपल, विथ लाइव पेशेंट और विथ लाइव प्रैक्टिस के साथ में हम आपको डिलीवर करने वाले हैं। तो आइए ज्वाइन कीजिए हमारे वर्कशॉप के लिए और मेरे वेबिनार के लिए। मेरा जो पिछला वेबिनार हुआ है उसको अगर आप सुनना चाहते हैं
Who is ideal? This webinar is for who is the ideal candidates. So medical and non-medical both, Ayurveda, BMS doctors looking to upskill themselves and their skills to grow their practice, freshers looking to start and grow their career, doctors from allopathy, homeopathy, medical any branches, nursing, even the pharmacy candidates.
Namaskar,
So
sir.
therapist can go. Yes, sir. Namaskar.
Sir, this is Dr. Ajay Prakash, naturopathy doctor, sir.
Yes, sir. Yes.
सर
Tell me,
मुझे
sir.
टाइम से ज्वाइन करना नहीं पाया सर आज।
Hmm.
मैं वेबिनार को फिर से देख सकता हूँ क्या सर?
Yes, sir. Yes. We are recording this webinar. So
Okay.
I'll share the recording shortly in a group. You are in a WhatsApp group, correct?
हाँ सर.
Yes. So I'll share the recording in a group.
Okay.
And after going through all the webinar,
Hmm.
you contact us. The number is also given in the same message for the contact.
Okay, sir.
What you are practicing and where you are from, sir?
Sir, I am from Tamil Nadu, Madurai. I am a naturopathy doctor, mainly practicing ONHA, Yamamoto scalp acupuncture and chiropractic, sir.
Great, great. So it is a great session for you to upgrade your skills and your earning too, sir. Earning
Yeah,
is most important, correct?
yeah, correct,
Yeah.
sir.
The way people used to see towards the alternative therapist or massage therapist, we have to change that view.
Hmm.
Okay.
And
We
also,
are
I am
ready
very
to pay
interested.
thousands of rupees for a single session or a single visit to the doctors or multi-specialty hospitals, but not ready to pay 200 rupees to the alternative therapist. But fact is that when
Hmm.
they tried everything, one
Hmm.
alternative medicine practitioner or massage therapist give them a
Hmm.
result and get them back to the nature and they start living their regular life, but still they are not ready to pay them or not ready to go to their place. They want massage therapist to come to their place. So
Yes,
we have
yes.
to change that perspective. So
Yeah.
that's why I am here with you, and I have already changed it for my brand. It was a very hard and tough journey, but we have succeeded, and lot of our students are succeeding. So here you can see the testimonials. So
Yes, sir.
someone is earning 1 lakh per month, someone is earning 3 to 4 lakh per month. Sir,
Hmm.
now Vivek sir from Sangli is charging
And
5,000 per
also,
sitting.
I am very much interested. I keep on learning many things, sir. And from your course, I saw in Instagram you teach myofascial release, which is not anyone teaching in India. First time I seen your ad only, sir.
Sir,
Myofascia,
they
I
are
was.
teaching in India, but to the doctors only, to the physiotherapist only. For non-medicals, no one is teaching, and the things which we have developed so that non-medicals can understand them and we can deliver it in a simple language. That
Hmm.
things no one is having, or that techniques also no one is having. So
Yes, sir. Correct, sir.
we have read all the Gita in last 4 years, and now we have a sar of Gita to you. Okay. So you will directly work on a results, work for the results. So this is the one person, sir, Prashant Yadav, sir. He was a massage therapist, and now he's a healer. And within a single month, he have treated 170 patient after completion of our workshop because of the results only. And he have just a few days before we had a discussion, he have generated within last 3 months. He have generated around 2.5 lakh rupees from his center, and which is in a village. Okay, and people from city used to come to him, and at a time in a single vehicle 10-15 people used to come from a single village to him. So how impactful it is when you actually deliver result to the painful soul. Okay, so the way, and he just following what we have suggested him, the strategy of marketing, the things we have taught, and he keep on asking question to us and sending reports to us. We keep on educating him, and he is growing. So there is no anything that I am a non-medico, so am I able to understand? Nothing like that. You can understand and you can perform very well rather than the medicos, because your slate is empty. So we can write the exact things on it. It is too difficult to remove the previous things from the slate and write new things clearly. Correct?
Correct. Yeah.
Be a follower and use our experience, and instead of doing the experiments.
Yeah.
Yeah.
Yes, sir.
So we have been featured on Z Media also for these things. And previously, people used to call me that this concept will never run. You are quitting your very good profession of stock market. You are earning in lakhs every month from a single training. I used to earn 4 to 5 lakh rupees, but I have quit everything and dedicated myself, my time, my life, my money to the holistic healing and traditional healing to bring it back to our society or in our culture or lifestyle. So the way we are working, and also the key aspect what I have dedicated, I have a dedication is our Go Sanskriti Nirman. Okay, so we don't know why we are the Nandi is preferable to pray before the Shiva. So what is the importance of Nandi? How that culture was established in our uh, uh, ancestors, and how single home was independent because of they are having a Gomata at their home. So how she is taking care of their health, lifestyle, their agriculture and everything. But the science we forget and everything. So I have to bring those science to back, and those who are carrying Gomata still and living with them, that go on that Gopalak, I have to work and make them strong. And we are causing a result for a cancer too. We have been treated lot of cancer patients through my experts in a team and recovered them. Many of the cases last recently in a last month, one case was did by Onkar Shastri Mule Vaidya. He is my one of the team member. The 18 cyst was in a brain, and he has cured those cysts within few days with the use of Panchagavya, Arka and Nasya. So on these things also we are working. But first of all, when we deliver a results, instant results to the society, then people will believe on these things also, and they'll follow these things as you ask them to do or go for it. Okay, so on that aspect also we are doing. So there are several celebrities also coming to us for the treatments of beautification or alignment or pain management. A lot of patients review you can see at our YouTube channel.
Okay, sir. Thank you, sir. Thank you so much. Sir, I am eager to watch this recorded session, sir.
Definitely, sir. I'll share.
Thank you, sir.
The what number I have posted in a chat for the payment, you can message on the same number on WhatsApp. So you will get the link of group or directly the recording link.
Okay,
The
sir.
number I'm putting again.
Okay, sir.
Okay. Yes, sir.
Yeah, noted, sir.
Okay. So thank you everyone. Thank you so much. Today's webinar we got around 5 payments. So thank you everyone for the payment. And some people are having queries. I am getting a message from a staff. So we'll take care of those also. We'll get back to you in the morning. So good night everyone. Enjoy yourself. Take care of yourself and become a healer. Thank you.